Hi, everyone. My name is Yvonne. I'm from TELUS Health. Thanks again today for joining us today for our webinar on how to create better patient and provider experience with Ocean. We're muting this conference today, so as you know, if you're speaking right now, we can't hear you, unfortunately. If you have any questions throughout the webinar, please feel free to ask them in the Q&A section on the bottom right corner of the WebEx screen. We'll do our best to get to as many as possible before we finish up. Today I'm very excited to introduce our partner, CognisantMD. For those who are not familiar with CognisantMD, you may be familiar with their patient-provider Ocean suite of products, such as Ocean Online Messages and Reminders, Ocean Self-Check-In Kiosk, and Patient Tablets. I'd like to introduce to Victoria Beckley, the VP of Business Development and Marketing at CognisantMD, and Dr. Doug Kavanaugh, Medical Director and Co-founder of CognisantMD. You can go ahead and take it away.
Thank you, Yvonne, and thanks to everyone on the line for joining us today and taking some time out of your busy schedule to learn a bit more about Ocean. We're thrilled to be here in TELUS office unexpectedly due to a bit of a flood in our own office, but thank you for hosting us here. I have an agenda slide, but I always like to know what to expect in a presentation, so I'll just give you a quick overview of what we plan to cover today. So to begin with, I'm going to introduce you to CognisantMD, both as a company and as a platform in general, and give you a bit of a high-level overview of the basic Ocean platform components. Then I'm going to pass things over to Doug. If there's something we've heard more than anything over the years speaking to clients, it's that they don't want to watch our slides, they want to see our product. So we're going to spend the bulk of our time today actually doing a live demo and with all the risks that come with that, but hopefully it brings reward as well. So I'll hand things over to Doug. He'll do a live demo where hopefully you'll learn about ways that Ocean can impact your own clinic. Finally, we've set aside a generous amount of time at the end for Q&A. So as Yvonne said, please don't hesitate to enter questions in the chat box as we go through the presentation. Our marketing manager, Melissa, is here monitoring for questions, and we'll do our best to get through them all before the end of the day. All that said, I thought I'd start by answering the question, what is Ocean and what is the Ocean platform? This term, really, Ocean's a patient engagement platform. We believe it's Canada's leading patient engagement platform, and I do think that the numbers really play that out. So when we look at Ocean today, it runs over 5,000 patient-facing forms in our library. Over 1,000 Canadian clinicians are using our technology today in some way. And on a daily basis, over 10,000 patient forms are being completed using Ocean software. All the things we're really proud of, but obviously we didn't get here overnight. I think understanding Ocean really, it helps to understand where we came from. So to begin with, Ocean was really the brainchild of Doug, who is going to spend most of the time today walking you through things. Some of you may know Doug personally. You may have heard of him as the software architect who wrote the version of PS Suite that is in practice today. Others of you may know him as a peer or a colleague in his role as a primary care physician. For me, my own introduction to Doug came about 6 years ago when he was explaining this vision he had for this company he was starting with his brother Jeff. A really unique perspective, having built an EMR and then going to medical school and then ultimately using that EMR really gave him a unique set of experience and understanding. It's that Doug got to experience some of the same frustrations that I'm sure many of you have experienced using an EMR. And that was really what drove him and inspired him to create Ocean. You know, he told me about how he was frustrated with the fact that we had electronic medical records and yet patients were still using paper and clipboards to enter information. And then somebody else is typing that information, and it was just an ineffective workflow. On top of that, he also talked about his own frustrations with a limited visit time with his patient, and he's spending half of it typing into the EMR. I'm sure some of those things resonate with people online today. So that was kind of the vision. And Doug was in a unique position to say, you know, if we could simplify the documentation process in the EMR by connecting directly with patients, we'd go a long way to making the clinical experience more positive, but also improving patient care. That's really where it all started with the Ocean tablet about 5 years ago. We launched It's in Your Waiting Room, and it was connected directly to PS Suite with the forms that could be edited behind it. Since then, evolved pretty significantly, and the product changes that we've made have really almost exclusively been made in response to the feedback to clinics that are using our product already. So we were listening as clinics were telling us the problems they wanted solved, and we really needed, and we responded. Today, we're super excited that we've added integration for MedAccess. We have clinics in Ocean in 6 provinces with continued growth, and we're really, really proud to have the support of the Canadian Medical Association and be endorsed by the innovation arm, Joule. So we've spent the last few years adding features to help solve your day-to-day challenges. And with taking burden off your front desk staff with self-check-in, streaming your intake with appointment reminders, and automatically including forms for patients to complete at home, or enabling your clinic to send a bulk reminder to a cohort of patients with just a couple clicks. Our development team has been working really hard to solve day-to-day issues in the clinic. But really, our perspective, the amazing thing about Ocean is really this problem solving that's being done on a day-to-day basis by healthcare providers and the staff that are using Ocean. We're hearing about clinics doing incredible things with Ocean, really addressing some of the most pressing challenges in healthcare in Canada today. So that's from implementing opioid screening tools, automating smoking screening, mental health screening, doing automated email consent capture. We have hundreds of clinics using Ocean for patient experience feedback and patient-reported outcomes. And we've seen the launch of some very powerful diabetes education and self-management programs. Honestly, just the tip of the iceberg. Those are some of the things that we're really super proud of. So this is to the product and the foundation of this platform that makes all of those things possible, and really is the form library. So thousands of forms in the Ocean library today, and all of them can be easily edited by any user. Form builder that also makes it easy to build your own forms, so you can take the forms that you may have in format in your clinic and add right into the Ocean library, into your own little Ocean library. So our really represents a huge shared library of best practices, and it's growing every day. So all of the programs that I just was talking about, the forms for each of those programs are already in the library and available to any Ocean user to use when they sign up. So using forms from the Ocean library to connect and engage with patients really throughout the patient journey. So that's before they arrive in the clinic with an appointment reminder that incorporates a form that's tied to the visit type, arrive at the clinic, checking in, and updating their demographics, contact information. Exam Room, of course, our flagship product, tablet. Patients are using those to complete clinical, administrative forms. And then after they leave, using Ocean to connect again and engage with their patients through secure messages and forms that patients can complete between visits or after a visit. The first touch points I just mentioned is Ocean reminders. There are a lot of benefits, as you know, to sending Ocean reminders. The obvious one that we hear frequently about is reducing a no-show rate. There's also advantages in terms of patient engagement, and we hear that patients really appreciate receiving these reminders. Well, I think to understand Ocean reminders and really what differentiates us from the reminder products that you might see in the marketplace, it all ties back again to our forms. So Ocean is the only appointment reminder that allows you to incorporate forms. So what that means is you're not just reminding your patient about their appointment, but you're actually getting them to start the visit before they even walk in the door. The best example of this is probably new patient intake. So for every patient intake type, we're automatically 3 days before the appointment, send them an email reminding them of the date and time of the appointment, ask them to please complete that form at home. And what it is, they've got the time to really think through their responses, and they're all going to be sitting right in the chart before you walk in the room to meet with the patient. It also has the advantage of allowing you to add as many times as you like, so you can be really, really granular in how you're communicating with different types, different visit types, and a number of other factors that you can write those rules around. You can set up Ocean to do reminders after an appointment, so that's handy for things like your patient experience survey or collecting patient-reported outcomes. So the next point in the patient journey, when the patient arrives, we can leverage the Ocean platform to check our patients in. So obviously, kiosks are super useful, have a lot of benefits around reducing burden on the front desk staff and streamlining the check-in process. But when Ocean is layering in this ability to do so much more, so whether it's demographic review and updating contact information, or doing clinic-wide patient screening, completing consent forms, email consents are really popular ones, or just sharing customized clinic announcements, all of this can be done on the Ocean kiosk. In the exam room, we look to Ocean tablet. Any number of forms, things like collecting a patient history or doing your medication reconciliation. Thousands of ways to use Ocean forms in the exam room, and Doug's going to walk you through a couple of those in a moment. Finally, Ocean online messages. So this is how Ocean gives you a way to securely send forms or just messages to patients between visits. So that's a one-off message, so maybe we're updating a patient about a set of results, or maybe you want to share some educational materials, instruction sheets, but it can also be used to do bulk reminders, so sending a specific patient cohort a reminder. And of course, all of our messages can incorporate as many forms as you want, and the results are automatically always going to be recorded in your patient chart. So I said from the beginning, we know what you're really interested in is actually seeing the product. So I'm going to stop here and pass things over to Doug and let him show you what it really looks like.
Victoria. So we're just going to transition to the demo right now. I'm really excited to show the entire toolkit here to you. The of tools we have to help you deploy forms and communicate securely and effectively with your patients. As Victoria said, the forms library underlies it all, and we have literally thousands of forms. So designing a demo was a fun challenge and an exercise in restraint. We could have demonstrated just about any of those examples that Victoria showed, but unfortunately we only had a short period of time. Consequently, what we've tried to do is have a semi-coherent story of a patient named Martha who is first interacting with the clinic through our email form reminders feature. So that's what we're going to demonstrate next. And we're going to transition, hopefully naturally, through her journey with various components of the Ocean technology platform. So, disclaimer, we weren't anticipating our office being flooded yesterday, and we are doing a live demo. So if there are any little glitches, apologies in advance. It makes things exciting. It's like live sports, hopefully more entertaining this way. And I think, without further ado, we're ready to get started. Everyone can see the screen now. So I'm in Practice Solutions Suite. The EMR is open here. What I'm going to first is into the email that Martha receives. Just bear with us. Okay, you can see the form here. So it's a link that advises Martha that there's a secure online questionnaire related to her health. I need to click the link. And to note that this email could have been received on Martha's home PC, some old computer running Internet Explorer, or have been run using her smartphone, so an iPhone or an Android phone. Forms library, the secure messaging is meant to run regardless of whatever technology the patient happens to have. So check, I'd ask for the patient's birth date. So here we'll enter her birth date. Secure message. So read this message and print it if she so chooses. Some patients prefer a hard copy of these things. But once you read the message, she can indicate that she's received it, and allows her to tell the clinic that message has been received. It's a bit like closing the loop. It's a handy feature that way. Without this sort of confirmation check, the clinic is left wondering whether a patient has actually read a message. We make this very easy to do, and in fact, the confirmation of the message, as well as the patient's response, goes into the chart automatically, as you will see soon. So the intake form for Martha. So she's in the clinic. She's received this information to confirm. So she'll review her demographic information, her name, her birth date, and so on. Any fields can be changed. Changes will go directly into the pay chart. Here he sees her medical history. So, and generally healthy. However, I would like to indicate that she has diabetes. Up there. Takes some medications, yes. She takes metformin, grams twice daily. She has naturopathic medications, allergies. All right, it's a little slow here, so there's a few delays. Okay, and it's complete. So that's informed that the clinic won't see her answers until she actually comes in. This is an important medical legal consideration. So it makes it clear that she shouldn't expect any immediate reply to these answers. However, the clinic has received them and can act accordingly. Okay. Next is going to open the clinic. So she completed her forms, and she will swipe her health card number, potentially. In Ontario, Nova Scotia, and BC now, imminently. I believe it's available. Patients can swipe their card on a MagTech reader instead of entering it manually. However, entering it manually is always an option, particularly for the provinces that don't support a health card swipe. Once Martha's swiped her card, review the clinic's introductory screen here. So this is a customizable screen. It supports multiple languages. So it can indicate that they support English, French, or Chinese, or Punjabi, whatever language is relevant to their patient population. Ocean and can support. So indicate that she speaks English. She'll review the clinic introduction here. An announcement about a slot. And she can review and confirm or correct her contact information. Now you see a form that's been programmed to show on this particular kiosk. So this is now consent form. It's real long, but it's important to realize that these forms are customizable. So some clinics have quite detailed email consent processes and language here. Others are more concise. It's really up to your clinic to decide. It's a very popular use for the platform. Does Ocean make it easy to customize the form? But the email address and the consent status is documented automatically in the EMR in a way that makes it easy for your clinic to follow up for patients who deny consent or defer. So you pulled the patient's email address from the chart, making corrections if necessary. Form that's been queued to appear based on a kiosk rule or a tablet rule. These are configurable options for your clinic. So some clinics don't use any rules, but they're an incredibly powerful tool in the Ocean platform. They do deploy just about any quality improvement plan that involves tablet-based communication or kiosk-based communication. For example, you could have form here, you can have flu shot reminders appear during flu season, but not during any other time. And the flu, the influenza here is actually configured to only show for patients who have not yet had their vaccine documented in the chart. So for patients who have had the flu shot, you can rest assured that it's not going to redundantly ask them this question. See if they're resistant to the idea of getting a flu shot, only takes the extra step in the interest of helping you as a clinician, actually asks why they don't want the flu shot. And this will give you an idea as the physician how hard you should to see whether there's some room for persuasion, I guess you could say. Now, one very handy answer I find now is that they prefer to receive it at the pharmacy. I'll get to this later. It makes it very easy to send batch reminders, email. And that allows patients to indicate whether they've had a flu shot or whether they'd like to receive it at the pharmacy or at your clinic. Next form now. That can show. So this was a form configured to show for female patients over age 50, and program it to only show at 2 years, for example.
I just apologize for the lag in the webinar projection. I realize you're a step behind us some of the time. That's not representative of the day experience with the tablet, but a function of the technology we're using to webcast to you today.
Thanks. I had no idea. Okay, so that completes the kiosk session. Now, efficient now as in the waiting room. So the kiosk has informed them that their answers have been received. One thing that Ocean does is that it will mark their status as arrived in appointment schedule. So I was pointing to the correct day here. Oh, I think we got to book her schedule, but she would show the little upward arrow. Sorry about the little oversight, guys. So if we had bothered to book her, then there'd be a little up arrow marking her status as arrived. So that's a really common workflow that clinics benefit from. So we're going to transition to a tablet flow. So they've now sat down. The clinic's been informed of her arrival, and the front desk then can act accordingly. So perhaps when the patient's ready to be seen, or even before that, there are some longer forms that require completion. Kiosk is great, as you can see, for these quick questionnaires, whether they need a flu shot or need to correct their contact information. But supports forms that are quite a bit more sophisticated and complex in that invitation. So they're perfect for a tablet because tablets are portable, they're a little more private, and they don't take up as much space in the waiting room. So patients can use them while they're sitting back down. Okay, are we ready for... Okay, so now we're going to share the screen for the tablet, which looks similar to the kiosk, but imagine a lack of surround hardware. And the tablet is unlocked for a patient. So this would be, So before we proceed, we have to decide what forms we're going to give the patient. The internist could make this call, or the physician. It's really up to your clinic to decide how the tablet is used in this format. Personally, look at my schedule, and if there are particular forms that I think would help understand the patient's clinical status a little better, and I will manually add them myself. But I can set up directives so that anyone coming in with a UTI, for example, or back pain, get a corresponding form. So I've set up a favorite for a patient coming in for a diabetes visit. So in that, the patient had diabetes earlier. So now imagine that she is coming in to see the nurse to discuss her diabetes. So what I've done is I've added that form as a favorite. The patient will know, based on the little number in the chart here, 511, that it should be given to the patient and unlocked with that very same number. So the introduction screen, this one can be different if you so choose. A little safety check, we ask the patient to confirm her birth date to ensure the tablet to the correct patient. And the first form, this form, I use it almost every visit. It's incredibly useful. It's a medication reconciliation form. What it does is it pulls the patient's medications from the chart, asks the patient to see what doing with that particular medication. And I think the clinicians in the room would understand how commonly an answer like not taking presents. Love to give this for patients who have a long medication list of, let's say, 10, and I'm not confident they're still taking them. And after this form is completed and I see the answers, there are only about 3 remaining, and I know that the renewal for those 3. So it's an incredibly fast, effective communication tool. The other great thing about it is that I get a sense as to their satisfaction with their medications, whether they're having side effects, for example, or whether they're taking other prescription medications possibly prescribed by the specialist, waiting over-the-counter medications like an NSAID that I may not be aware of, or homeopathic or naturopathic medications. Every diabetes visit, in addition to this form, this is bread and butter of the diabetes visit. It's typically what the nurse or if a physician is not fortunate enough to have a nurse to help. These are the questions that we spend so much time on, and I think this is one of the reasons the diabetes visits are compensated more generously. This is really time-consuming. The fourth ocean can get these yes-no questions out of the way. For example, they indicate that they're having some probably hypoglycemia in her case, maybe some diarrhea with the metformin. That's good to know. We can dwell on that instead of spending most of our time just asking these questions to begin with. These questions that I do could cover every visit, while they're optometrists, how those readings are. And you can see the form adapts based on their answers. So if I haven't been testing their glucose, for example, it doesn't bother to ask them about their glucose readings. Monitoring. And This form is sort of a motivational interviewing approach. You can use forms to not only obtain information, but patients come to a treatment plan or a management plan in conjunction with your recommendations when you spend time on it up front. And here's a spoken question. And finally, the form that I've queued, the PHQ-2. This is, I'm sure are familiar with the PHQ-9, the standard depression screening tool. PHQ-2 is often recommended as a quizzing tool for patients with diabetes to gauge whether depression may be influencing their life management of their condition. So one thing that's neat, for the sake of time, I won't do it. I'll screen negative here. But this PHQ-2 is positive. OSHA is smart enough to then present the PHQ-9 form. And when PHQ-9 form is shown, OSHA is smart enough to calculate the score automatically, just like the PHQ-2 here, and see whether they're having suicidal ideation. In which case, it will show another form to gauge whether this suicidal ideation is something imminent and concerning, requiring a referral to the emergency department. So all things just happen before you have even looked at the chart or walked in the room. OSHA, when you get to the end, will call those answers from the patient, and if they're French, they'll translate it automatically into English, and then it'll be inserted in the chart, no copying and pasting or scanning required. And they'll hold, here are answers. So they're reconciliation, and so they're metformin. Know that it needs renewal, so I can get it ready before I walk in the room. The nonsensical answer I answered, sorry about that. Diabetes visit here. So you can see what OSHA has done is to split apart the positive symptom, the diarrhea, negative symptoms. Diarrhea is sort of halfway between a red flag and you know, a normal symptom. You could choose to have this symptom flagged in red, just like suicidal ideation is, to make it stand out more. That's the kind of creative control you have over the forms. But pertinent negatives together, it makes it that much easier to just quickly scan the chart. Answers. Now, sections can be bolded, so you can have these bolded if you prefer. So here's a nice, concise note as opposed to a really long, verbose answer format. Here's Q2. Interesting score because I put 0 for both. You can see it has totaled both answers and put it in a format in the EMR amenable to graphing and searching. Solutions, for example, if you graph the PHQ-2 or the PHQ-9, it will put OSHA answers and put it in a spot in the chart. You can also search charts for quality improvement purposes, for example, or screening purposes to find these answers. Because it's not just free text. That's one of the wonderful things about OSHA. It gives the clinical note that you need, but it also puts it in a format that's much higher quality than a simple typed note. So it's the tablet example. Now see to OSHA Online Messages. Patients completed the tablet. You can imagine walking in the room, treat a patient in the normal manner with a diabetes visit. And the time comes for you to follow up with the patient. So what we do is call your attention here to the email button in Solutions. So what we've done is we've provided a very quick, easy access link in the chart to functionality. So the favorite button earlier to add the diabetes form. This email link will ocean with a single sign-on populate the patient's email address. Now, attaching things is quite straightforward. So if I wanted to send a requisition to the patient for their follow-up blood work or lab results, an alternate result. That sort of thing is very easy to do with Ocean. Fortunately, that's giving me some trouble here. Let's try again. Whoops, I closed by accident. Try again. Okay, here we go. So the send email screen. I can see a bit of a lag on screen, but it hasn't out yet. Thanks for your patience, everyone. Be able to do with this screen, once we include any optional attachments. I'll be able to type a secure message. I'll be able to add any form, and choose an option that does all of the above for me automatically with one click.
Perfect. We are back.
Great. Okay. False alarm. So give me a chance to digest it now. So where I can type the secure message. I could say, for example, hello Martha, your lab results looked good. Please follow up in 3 months. Now, if you're a slow typer, you can take advantage of these templates. So what do you do? Put that in for you, assuming, of course, it's something you can recycle. Let's fill in the subject for the email. It will send the email body. So this is the plain text email, the one that they see in their Gmail or their phone without in. So it's usually boilerplate, quite direct, so that it doesn't read any personal health information. Here, the secure message, that is the part that they see when they click on the link and authenticate, usually with some simple information like the birth date, as you can see here. This template has enforced that the patient has to enter their birth date and they have to access a live link in order to see this secure message. The template automatically added this diabetes self-management medication action plan. This form the form here, you can get a sense of what it looks like. It's that provides an option for motivational interviewing. So if you're with a patient with diabetes and you're hoping to help coach them to improving their blood sugar levels through a better diet, forms like this are very handy. And the answers to this form, along with the response to the secure message, will appear in the chart when mailed. I'll call your attention to this little checkbox here, allow reply. This is something that keeps the driver's seat as a clinician. It's not a patient portal so much as a messaging tool that allows you to send out messages without necessarily being inundated with more information. It allows you to keep the conversation in a closed format by unchecking allow reply. Email now. So it goes in there. And this time we'll leave off the answering of that email because we want to spend a little time on this handy feature called bulk messaging. Individual emails is great. However, often what we want to do is in a population level. This comes up all the time when it comes to preventive care. If you think about your major screening categories, pap tests, mammograms, flu shots, FOBTs or colonoscopies, even things like AAA screening Ocean supports. There's a form for that. Vaccines, flu shots, as I mentioned earlier, you can send out batch questionnaires for that. The pneumococcal vaccine, there's a form for just about any intervention you can think of in medicine and many, many specialties as well. So what we'll do is we'll sign into the Ocean portal, which is not something you have to do very often, by the way. Our goal is to keep you out of the portal. We know you're more comfortable in the EMR, but when it comes to these bulk messages, it's well worth it for one of your staff to just learn how to do it because it's an enormous time saver. What we're going to do is log into the portal and upload a export search that we ran in the EMR for all patients over 65 who are due for their flu shot. So it's not patients who have already had the flu shot, just ones who we think still need it. Maybe had it already at the pharmacy, we don't know, but we'll find out when we email the cohort. So when into the portal, you can browse and find patients, or you can choose to upload one of these bulk files. With this working around the internet again. In the bulk email, it's going to go out to every patient in that export, and the answers will come to the EMR one at a time. So as an email, who happens to click on the link will be able to answer that questionnaire, and when they indicate that they've had their flu shot at the pharmacy, you're going to see that in the EMR the next time you open the chart. That's to then do a sort of second round options where you can send another batch email, or you can have your staff merely take note of that. You can have your search to generate this list in the first place excludes patients who indicated that they've already received the vaccine. So rather than having to call these patients one by one, you do this intervention with just a few simple steps. Has pooped out on us. Do we want to ask? Do you want to check questions? That'd be helpful.
Yeah. Well, why don't we jump into some questions? And we've had a number of questions come through, but let me start with the question language. So there's been two language questions we've been asked: whether or not Ocean does translation of forms, whether those are available in the library, and also whether or not Ocean will automatically select the form in the correct language based on that initial language selection. So I'll let you answer that.
Great questions. I forgot to mention some of those things, actually. Ocean will key in on the language field specified in the EMR when it's available. So EMR, if you've indicated that a patient speaks French, then Ocean, in that tablet or key introduction screen, will pre-select the correct drop-down value. So it will indicate that they speak French, and thus the patient doesn't have to keep indicating that they speak French. Actual translation is a depends sort of answer. So the many forms in the library, the very popular ones, like the PHQ-9, have already been translated into many different languages, French being the most common, but there are several other languages that we support with some forms. Arabic, for example. And so these other languages will display automatically when the patient indicated that they speak that language, or when Ocean is able to pull from the chart they speak that language. Many of the forms are written only in English. I don't want to mislead anyone that way. However, you can do your own translations. It's a straightforward process. The eForm editor, as Victoria mentioned earlier, is very easy to use. And the translation is also easy. You essentially export a file and look at the English string and type in the Portuguese string and upload it. And lo and behold, you've got a form We don't do that ourselves, but we help you do it. And we also have independent contractors who can assist with that.
Great. I've also been asked about pricing and whether or not all of our items, the portions of the platform, are priced separately. And I'm happy to answer that one. I'll start by directing you to our website. Anyone who's interested in pricing, we do publish all of our pricing. We're completely transparent about all of our pricing. So you go to CognisantMD.com/pricing. You can find that under the Products tab, and you'll see all of our pricing there. But in the answer is our products is typically work in a very a la carte manner. So you may have tablets or tablets plus messaging, and then you may have user messaging, or you may want site-wide, which then gets you automation that would work in your reminders. But all of that is described on our website. So we've also been asked, Doug, can we customize how answers are populated in the chart?
Yeah, absolutely. The core library is a certain style meant for everyone. So you prefer to not have certain questions or to have more white space in between your sections. It's really easy to take one of these forms, remove redundant questions or the ones that you think are a bit silly, add your own, and the formatting. So help clients, we have an empowerment sort of support model where we want to help you learn how to do it. Support portal is very that way. And we also have contractors available if the whole process seems onerous.
Great. We've been asked whether or not patients will be able to do online booking through Ocean. And again, I'm happy to take that one. So we see online booking as a really natural next step in the patient engagement journey, and it's certainly something that we definitely want to support. We are working very closely with the team at TELUS to bring to market. There is a prototype in play, and we're excited to offer it, hopefully, to TELUS users in the near future. So stay tuned is what I would say about that. Jeff, there is a question about these. Just through them as not what I was looking for. Whether or not this will be recorded, the answer is yes. So you can share this with your colleagues. But is email access needed at the user's workstation in order to send online messages?
No. So you do not need to have any sort of external email account configured. For example, an email account, but it has nothing to do with Ocean. I don't need to be able to access it. The only thing you need when sending secure messages is any sort of internet access. It doesn't need to be on the same network as your clinic. But Ocean's a cloud-based system. You do need to be able to connect it or cloud. It takes care of all the emailing. I should also note, the nice thing about the Ocean emailing system is that it's one way, so it's a no reply address. That means you don't have to worry about patients responding external to Ocean.
So if somebody's wondering whether or not we have any plans to set up automatic messaging to clinicians when a form's been completed or a form's been viewed, specifically can go into the PSN box. So I think I'll leave that with you, Doug.
We don't currently support that feature. It's something that we've talked to TELUS about, so we're exploring the feasibility of that. I think it certainly does have some advantages in theory. However, we've had too much pushback on limitation because people have email notification processes set up, and it can point you directly to the message answer, either in Ocean or in PSS. So you can look up the chart and then instantly you see the patient's answer. Have certain safeguards with email notifications to ensure that if messages are overdue, they're followed up appropriately.
Also, further to that, Doug, with the new UI changes coming to the portal, which will make reviewing of any overdue messages or reviewed messages really simple for the clinician.
That's right. I think we're going to have to wrap up. I just want to briefly thank TELUS profusely for hosting us today and assisting with the presentation. Sorry?
Yeah, I think I think Yvonne is probably going to close things out for us. But I know we didn't get to all the questions. Apologies, we were sort of trying to work through them in real time. We are happy to answer anything by email, though, so please don't hesitate to reach out. The TELUS Sales EMR is up for you there, and so if you want to share your questions there, we'll definitely respond to them in kind.
Thank you so much. Thank you for the team at CognisantMD for providing us a quick demonstration information about your solution. Once again, the email is up there. If you see it, telussales.emrs@telus.com. By all means, send all your inquiries over there. We'll definitely get your answers and any questions that were not answered. The recording is, the webinar is recorded and will be shared to everyone. So thank you again for joining us today. My name is Yvonne from TELUS Health, and have yourself a great day.